Vanakkam. Welcome to this course on classics in neuroscience. We have been looking at psychopharmacological agents on the breakthrough in the field of psychopharmacology to treat patients with psychiatric disorders or neuropsychiatry. In the previous video, we looked at reserpine, butyrophenones and iproniazid. In this video, we look at antidepressant drugs, specifically MAO inhibitors or monoamine oxidase inhibitors. We will also look at imipramine and other tricyclic drugs. In the 1930s, an enzyme that degrades the amino acid tyramine in the liver of rat was discovered. This tyramine was an amine compound. A large family of amine compounds were identified to be degraded by this enzyme, and the enzyme that degrades all these amine compounds came to be called as monoamine oxidase or MAO. Many compounds were tested for anti-MAO properties, but most important of them were hydroxides. Remember, in the previous video we looked at iproniazid and isoniazid. These were hydroxides. These have anti-monoamine oxidase properties. Albert Zeller was studying the effect of amines and how amines were degraded. He found that degradation by this monoamine oxidase. He also found that iproniazid was perhaps the most effective substance known in blocking this effect of monoamine oxidase. They performed, Zeller and his team, they performed their own many clinical trials and clinical studies to study the use of iproniazid in the treatment of depression. They came up with this hypothesis that monoamine oxidase might terminate the action of epinephrine and other monoamines at adrenergic synapses, post-synaptic or in the synaptic cleft. Like you have acetylcholine esterase that destroys acetylcholine at the neuromuscular junction. It was hypothesized you have monoamine oxidase that hydrolyzes or that metabolizes monoamines such as epinephrine, norepinephrine, dopamine, serotonin in the postsynaptic or in the synaptic cleft, similar to the action of acetylcholine esterase. That was the original hypothesis. Later, it was found that actions of monoamines are in fact terminated primarily by a different mechanism that prevented reuptake into the presynaptic terminal. That essentially transport of these reuptaken monoamines is prevented and packaging it into the vesicles perhaps is the mechanism that was later studied. Hug Blaschko found that the metabolic pathway for synthesis of monoamines from tyrosine hydroxylase through dopamine and norepinephrine to epinephrine was identified by Hug Blaschko in 1939. And several scientists were interested in this field. One of them was the brilliant and imaginative Bernard Brodie and others such as Parkhurst Shore. In 1957, they found that reserpine depleted the amount of serotonin that could be measured in the whole brain. So, reserpine was a very powerful monoamine oxidase. So, it could deplete the whole amount of serotonin that could be found in the whole brain. A similar effect was found on the neurotransmitter norepinephrine. It was also found that reserpine could deplete dopamine too. So, a way to inhibit the effect of this MAOs, monoamine oxidase, was to be identified, and the most effective of them was hydrocytes. We already mentioned this. After chlorpromazine became a popular antipsychotic drug, people were exploring the use of other immunodibenzyl compounds similar to chlorpromazine. Essentially, the set of compounds that have 3 benzene rings in a row with an amine group that is several carbons long attached to the middle ring. It turns out that chlorpromazine was expensive. One of the scientists who was testing the use of chlorpromazine in the clinic was Roland Kuhn in Switzerland. So, he asked chemists at Geigy Pharmaceuticals for a compound that was similar to chlorpromazine, but was way less expensive, because he could not afford the use of chlorpromazine for his patients. So, people suggested this G22355 or imipramine. It was found that in 3 patients, he found there was a dramatic or great positive effect, which he reported in the Zurich conference on the 2nd International Congress of Psychiatry. There were like 10-12 people in the audience, but word spread very quickly within the field. It is a small world, it is a very small community. So, everyone came to know about the use of this imipramine, and people were excited by the use of imipramine and other tricyclic drugs. Since recently these tricyclic drugs have been replaced by the SSRIs, that is selective serotonin reuptake inhibitors. SSRIs in the treatment of depression. With this, we come to the end of this video. In this video, we looked at antidepressant drugs, specifically on MAO inhibitors or monoamine oxidase inhibitors and imipramine and tricyclic drugs. Thank you for your attention.